These days, a trip to the doctor's office doesn't necessarily mean a trip to the doctor's office. More people are taking advantage of what's called medical alternatives, and our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here to discuss it. You talk about primary care being unbundled.
Yeah, so I think we have to realize that there are a lot of things that go into healthcare, whether it's the pharmaceuticals, whether it's the doctor visit, whether it's how you see the patient, telemedicine, a whole host of other things actually go into healthcare. And what we're seeing over the last decade, and really catalyzed by COVID, is that everybody's getting into healthcare, whether it's retail clinics, there's something called home monitoring, medication monitoring, telemedicine. And what we really need to talk about too is how the big boxes are getting into it, right? So recently, Amazon has gotten into this game, and they've been doing pharmaceuticals for a long time, and they recently launched this thing called Amazon Pharmacy, where essentially you can get your medications for $5 a month. You know, the one that kind of blew my mind was Dollar General. In some cities in America, Dollar General now has a bus outside of the store where you can get primary care.
And you know, Walmart, which already has Quest Diagnostics labs in some locations, they're looking to add more services.
Yeah, absolutely. So Walmart has Quest, Walgreens has LabCorp, and Walmart is really one of the biggest sort of healthcare systems in the country because of the number of employees they have. So they already have medical, they're adding dental, they're doing mental health. It's really, again, healthcare is the largest part of our economy, and people are trying to get into it to get a piece of that pie.
Now, I've taken advantage of telemedicine services, and I'm certainly not alone.
No, you're not. So whether it's in the Hispanic population, the rural, above 55, women uninsured, across the spectrum, people are realizing that for some pieces of care, it's actually better to do it online, right? And so we'll talk about that as well.
All right, and let's look at the preferences of whether it's telemedicine or whether it's in-person care.
Yeah, it makes sense, right? So it's easy to get a prescription refill. A lot of times you go to a doctor's office, you spend an hour to 2 hours just sitting in that waiting room just to get a script. A lot of those things can be unbundled and use technology to do them. Minor illnesses as well. Mental health has actually taken a huge tick up during the pandemic. Now, obviously, physical therapy, you're not going to do an emergency room visit online, right? And so some of those basic things that you need an in-person physician visit with are very different.
And just when I was about to ask you if you felt like you were going to be out of a job, you have results from a poll that says otherwise.
Yeah, so I think that hopefully within the next 20 years, I will not be doing the job. And so this isn't going to affect me. But now and over the next decade specifically, I think patients consistently are aligned with their physician and clinician's office. And I think that's important. However,
younger patients apparently disagree.
Yeah, looking into the future, and this is where a lot of these big boxes and tech companies are going. They realize that if you're under 40, you have a preference for telemedicine over in-person, and that's where they're going to put their investment to make sure that the next generation of healthcare looks very, very different.
But bottom line, doctor, it all comes down to healthcare costs.
Yeah, it's all about the Benjamins, as they say, right? People follow their wallet. If you can't afford care, you're going to go for what's cheapest and what's most efficient. I think it is important to say, and we talked about the Amazon $5 plan, GoodRx is another example. There are resources in our community, and even if we are sometimes healthcare shortage reduced, there are resources, whether it's a University Medical Center, whether it's El Paso Health, a host of organizations, Alozie and Co., which can get you the right care that you need, and I think that's important to talk about as well.
ABC7 medical contributor, Dr. Ogechika Alozie, thank you so much.
Thank you, sir.